Welcome to the First Nations Health Managers Association's weekly town hall. Over the next hour, we will provide an update on the COVID-19 And now your host, Marion Crow.
Tansay from the Mississaugas of the Credit, the Haudenosaunee, the Wendat, the Huron, many diverse nations here in Toronto is where I'm joining you from on this edition of the FNHMA Weekly Town Halls. We are so delighted to be having you listen, watch, welcome us into your homes, territories, and organizations all across Turtle Island from coast to coast to coast. We thank our Indigenous media partners who are live streaming this on their radio stations, on their Facebooks. And don't worry, you too can watch this if you want to watch it again. Saturdays at 5 p.m. Eastern. Check your local listings for your local time. It is a delight to be transitioning this town hall from the heaviness of COVID-19 to our life expectancy. 87,500 hours is what we've worked out to be approximately 10 years of life expectancy that Indigenous people live less. We hope you join us in finding solutions and ways to close the gap in those life expectancy rates. With that, I want to say a special thank you to the FNHMA team. I know that you'll be giving me shout outs and call outs to the inbox. And if you have a question, please submit those to fnhma@ihtoday.ca. Well, it is a delight and privilege to welcome her first time joining the FNHMA Town Hall, but we have our Indigenous Services Canada representative who will provide some context into the stats that we're hearing from our partners at Indigenous Services Canada. Dr. Cleary, why don't you come on in to the crow's nest? Welcome, Dr. Cleary.
Thank you, and good afternoon. I would first like to acknowledge that I'm speaking to you from the beautiful and unceded traditional lands of the Wolastoqey. And thank you for inviting me to share some of my thoughts with regards to the ongoing pandemic of COVID-19. I'm sure many of you, if not all of you, like me, are getting a bit tired of hearing about it. But I'd like to explain why I think we need to be both optimistic and at the same time cautious for the next little while. So in terms of numbers, the numbers have fluctuated over time since spring 2020. It went up to a high last year in January. It was up and down over the spring and fall. And then last December, we saw a new rise with the Omicron variant. And that has continued to rise up until a high peak mid-January. So just a couple of weeks ago, and it looks like it's starting to decrease again. And the highs and lows have been driven by a combination of protective measures, which all of you have been involved in, and which has put a strain on everybody. But they have worked to decrease the numbers of virus circulating. But it's also influenced by the type of the variant that's circulating at a particular time. And it has varied substantially from province to province and community to community. So for an example, the number of communities with active cases last August was about 72 communities across Canada. And that increased up to a high of 309 communities in January. Since then, the number of communities with active cases has decreased to 263. But that does mean that a number of communities that hadn't seen any cases at all were starting to see cases and outbreaks in recent times. Another difference is that we'd started to see an increase in the rates of children's cases in recent weeks, with children being affected more compared with older age groups among First Nations, but also compared with rates in corresponding age groups in the general population. Another important point is that the cumulative rate of COVID-19, that's all of the cases added up together, in First Nations communities has exceeded the rate in Canada as a whole since pretty much the beginning, or at least since December 2020, and is now 2.2 times the rate in the Canadian population, the general Canadian population. Fortunately, the hospitalization rate is lower, as is the case fatality rate, but as of February 2022, so this month, or well, last month, I suppose, seeing as today is the 1st of March, the rate of death in First Nations communities is now higher than the rate in the general Canadian population. In terms of vaccines, many communities have a high proportion of people vaccinated, but in general, these numbers are for First Nations, Inuit and Territorial communities. About 87% of individuals over 12 have had a second dose, and about 25% have had a third dose. 49% of children between 5 and 11 have had at least one dose. So this means that there is a lot of vaccination that has happened, but there is still room for improvement. So overall, what this data tells us is that Indigenous communities continue to be at a higher risk of disease and death from COVID-19. The data clearly show that those who are not vaccinated do much worse in terms of hospitalizations and deaths if they get COVID-19. So vaccination is important, not only to prevent against poor outcomes, but it also prevents communities from outbreaks. And the other point that I would like to mention is that although there is a decrease in cases recently, there's still a lot of disease around. So I mentioned I was going to talk about why we need to be optimistic. Well, I think what we've learned over the last couple of months is that although the Omicron variant spreads more easily and more people are getting catching it, it continues to be true that it causes less severe disease than other variants. And so the hope, the strong hope, and perhaps the expectation among many public health experts is that eventually this will become another background virus that we deal with from season to season, a bit like the common cold or the flu. We also should be optimistic because there are high levels of immunity from people who have been infected and vaccine. The two together actually provide a high degree of immunity. And so we're not as susceptible as a population to severe disease. And the other thing we need to be optimistic about is now we have a chance with the transition away from focusing exclusively on the pandemic, that there is now a chance to get back to doing other things that are important to them, like spending time with family and friends and traveling, etc. And that communities can get back to reopening businesses and workspaces, and that health systems can try to address areas where people may have fallen between the cracks through lack of services. We know there's a lot of other important things, problems in the community, some communicable diseases like syphilis, TB, but also chronic diseases, addictions, and so on. So this is all important to get back to, and we should. However, we do need to be cautious because we don't exactly know how the disease will evolve. And right now, we still have high levels of disease around, although this does vary by community. So during this transition phase, while provincial restrictions are evolving, it's going to be extremely important for each community to self-determine their own particular level of risk from COVID-19 and how best to mitigate it. I'm going to repeat that because I think it's really important. There's a transition phase where we are now to where we hope to get to. We don't know how long it will be. Provincial restrictions are evolving. And so each community must take a look at its own risk and determine what actions they need to take to prevent themselves from poor outcomes, as well as moving forward. So the types of things that need to be considered are how to ensure as high vaccination rates as possible, how to understand the amount of disease in the community by continuing to support testing, how to reduce the amount of disease by encouraging and enabling people to stay home when they're sick, especially if they test positive for COVID, and then to consider the situations where it might be still appropriate to continue other public health measures such as physical distancing and masks. Most of all, probably because this is something that goes beyond COVID times, is to how to encourage and support a healthy lifestyle and reduce inequities, because strong, resilient people fare much better with all types of illness, including COVID. Thank you.
Dr. Cleary, so many good messages in what you just unpacked. And I think a lot of that is, ensuring your place geographically, that you're following what's happening close by when it comes to trends, restrictions, and we know that people are going to have a couple more COVID-19 related questions. So don't go anywhere, Dr. Cleary. We'll be back to bring some questions in. And don't forget, you can send your questions to FNHMA at ihtoday.ca. Thank you, Dr. Cleary. And we're going to take a short break. Be right back.
There's no such thing as an old addict. You either get clean or you die. I knew I needed to stop for my kids and my grandkids. There is hope and there is people that do care and they do love you. I learned that our culture teaches something very powerful: compassion. Through acts of kindness and compassion, we find meaning in ourselves. I found connection. When we're connected, we're never alone.
There's lots of bullying at the school that I come from. I ended up in a neck brace. I had a concussion. I got kneed in the back of the head. Sometimes things can get really bad and you think, there's no point of being here. The support from people around you has a lot to do with the anxiety and depression. Because I'm different, a lot of people didn't understand. Through acceptance, we find belonging.
I love the Soar Above Stigma campaign. Thank you again to Dr. Brenda Ristool at First Peoples Wellness Circle, Dr. Carol Hopkins at Thunderbird Partnership Foundation, and of course, our partners, Indigenous Health Today. Well, we are going to talk about a difficult topic. So I just want to remind everybody that this is a bit triggering for some folks. We will make sure that we put some resources up for you should you feel the sense and need to reach out. With that, we are going to talk about racism in the healthcare setting. For many people, we know there was national dialogues happening, but it's not just the bravery of Joyce Echaquan that started these dialogues. There has been a commitment to end racism in healthcare for quite some time. And joining us on the FNHMA Town Hall is President and CEO of Indigenous Reconciliation Group, Rose LeMay. Rose, why don't you come on into the crow's nest? And let me just tell people that you are most recently an honorary mention for the Global Pluralism International Award. We offer our sincere congratulations for your advocacy, your tireless work, and for your voice as a columnist at the Hill Times. Rose, join me in the crow's nest.
Well, thank you, Marion, and it is quite an honor to receive this recognition. I think what has really hit me in the last little while to talk about racism is the number of people who are actually listening. I've done this work now for longer than I want to think about. And because of the voice of Joyce Echaquan and because of her decision to publicize what happened for her and her family, there has been so much more discussion about racism in healthcare. But not much has changed. I doubt that the First Nations youth going into the Thunder Bay Hospital, or the Inuk youth going into Montreal to look for services, or a Métis mom looking for services in Prince George, I'm not sure that they will consistently see a difference yet, because we do need a full transformation of healthcare. Racism, in essence, is built right into our healthcare system. We have a race-based healthcare system. For First Nations, it's funded separately from the rest of Canadians. We could call it a color-coded healthcare system. Different colors receive different degrees of excellence at some local healthcare organizations. And there hasn't been enough to change any of it yet. Now, we have had some changes, but you know what happened? COVID. The country prioritized vaccinations for Indigenous peoples, and so many healthcare workers were forced with a different way of looking at what is priority. And I think that probably started some discussions. But you know what really changed is the media covering the unmarked graves finally. We have always known as First Nations and Indigenous peoples, Métis and Inuit, that our children, some of our children have not come home from residential schools. But something significant changed when the media started to cover it. And so I do actually have to hold my hands up to media outlets across Canada, from CTV to CBC to Globe and Mail, who are now choosing to cover these stories that involve Indigenous peoples in a good way. We needed that. It did not happen through the Truth and Reconciliation Commission, and it's happening now. And I think what most of my work now is talking to people who are not Indigenous, who are suddenly feeling the weight of this. There is literally a weight, an emotional weight to this. And sometimes I might joke about it, right? I think we all find ways to joke about it. But it actually has become even harder now that we're talking about the problem of racism to then be advocating for something different. Somehow it's harder because everybody wants to talk about it now. And yet we don't have enough change. We do have local leaders all across Canada doing things differently, from Canadian Partnership Against Cancer, who is going through a very strategic approach to try and figure out what should they as an organization do to really enact, to put into practice reconciliation. We have hospitals across this country doing significant work. We have universities trying to do things in a better way, in a good way. University of Ottawa putting in policies around how to support and pay elders what they're worth when they give advice. There is local leadership across the country, but we have not seen it at a systemic level. Apologies, Dr. Cleary, but it's not great when Indigenous Services Canada receives the award for the Code of Silence. We need to see Indigenous Services Canada out there playing that partnership more, playing more of a leadership role. How do we know that we haven't made this enough of a priority yet? If we had made this a priority, we would have funded a pan-Canadian health organization to address this crisis. That's what we did in the past as a healthcare system. If we understood that it was a systemic issue, we would actually fund a big organization with serious influence to advocate and facilitate change across all the different healthcare systems we have in every province and territory and federally. We don't have that yet. We don't have that big funded organization who sits at all the tables they need to sit. We don't have a table of health ministers who are prioritizing yet racism. And so when I go into the hospital, I still fear it. I still fear getting the questions because they think I am First Nations, therefore I am at different risks that I must be, and here's the stereotype for healthcare, it's not new, that I must be on drugs or drunk. The stereotype's still there. Individuals are still facing this, so how do we actually change it? Well, I think we need to dig in and continue to have these harder conversations, as hard as they are. We need to call the federal government to account. Every single contribution agreement that goes out the door with funding attached to every single health organization they fund, it should have a requirement in it for anti-racism work. If that funded agency doesn't have it, why should we fund it? If First Nations and Inuit and Métis are literally at risk of going into healthcare, racism as a quality patient safety issue, why are we not holding agencies and organizations to account? So I call on the colleges of nurses, the colleges of doctors, every single physician specialty, dentists, all of the colleges to start doing this work very quickly. Hold your individuals to account. Hold yourselves to higher standard. Because we need to have hope. We need to have hope this could change. Let me offer you what it might look like if we did not actually have racism as an issue in our face every day. And this is hard to talk about. I live in Ottawa. The convoy was dramatic. It affected me. I live far enough away that I didn't hear it, but I felt unsafe. I didn't feel safe. I didn't go downtown. I felt unsafe. We are at a crossroads in this country. We're on the crossroads of white supremacy making significant inroads thanks to social media bots, thanks to the crazy amounts of misinformation now on social media. So this is difficult to continue to have hope. But let me share something that I hold on to. We as First Nations people tend to have jokes about the resilience. We have jokes about racism we only share internally. But let me try and peel that back. What would it be like if we did not actually have to be resilient? If we did not actually have to kind of gird ourselves against the potential of racism? And how much more energy we would have for other things that are so much more important. What would that look like? Would we walk into the Thunder Bay Hospital and say, this is my hospital because I feel they serve me as with excellence as any other person in Canada? What if all of that energy we had, that we weren't constantly kind of protecting ourselves against this? What if then we were able to rebuild and document and share and strengthen our own Indigenous knowledges of what wellness was? Because we are bringing this back. And it could go so much faster if we weren't held back with racism, if we weren't held back with inequities in the healthcare system around inequities of funding. It is really hard to hold on to hope nowadays. And some days it is a decision. We wake up in the morning and some days I say, I choose hope, even though I don't feel it. I choose hope. I choose this hope for my granddaughter who is running around happily, not even knowing what racism is and what if she could live her whole life like that. That is the hope I hang on to. Marion, thank you.
Thank you so much, Rose, for sharing those words, some thoughts, and really capturing a feeling. And it's like a pulse that's happening in Ottawa, especially right now after the display of white privilege that we just survived for the most part. Thank you, Rose. I do want to bring in another amazing guest, the Chief Executive Officer of the Canadian Indigenous Nurses Association, Marilyn Oswig. Come on in to the Crow's Nest, please. Marilyn, welcome. And I want to say thank you for being the longest serving Indigenous Health Professionals Association out there, Marilyn. Thank you. Come on in.
Thanks so much. So this isn't a repertoire dance of mine, but I'll do my best at getting a crow hop into the crow's nest. Marion, thanks for asking Canadian Indigenous Nurses Association to come forward and be a part of this conversation. So as you said, I'm Marilyn. I'm originally from Thunder Bay, and I'm from the Fort William First Nation. However, I reside in the unceded territory of the Algonquin people in the National Capital Region. Rose, I want to thank you for bringing to light Thunder Bay, my old home, where things have not stood, opportunity has tried to move forward, but racism has stood the test of time. Dr. Cleary, thank you for bringing forward some very dynamic points to consider in the data that you provided, to which I will address very shortly. But before I begin, I want to take this opportunity to just say miigwech to the nurses out there. Thank you to the nurses out there, to the frontline workers whom tirelessly went to work every day without complaining, because that's the love that you have for your people in your community. I want to thank the retired nurses who came back to work to help out with intake, gowning, so on and so forth. 2020, when it started out, was supposed to be the year of the nurse. We were supposed to be celebrating our nurses and our midwives, but COVID had another plan for us. We didn't see that, we the Indigenous people, didn't see that as a challenge. We saw it as an opportunity to once again stand beside each other, to hold each other up in a time that was crucial for healthcare delivery. We saw it as a time to recognize the professional standards, the education, the knowledge, and most importantly, the Indigenous ways of knowing that has been brought forward to the speech from the throne, that has been brought forward from many Indigenous health organizations. CINA has been behind the efforts to look at policies, gaps, regulatory, legislative, funding, and the list goes on and on. We are now at the cusp of looking into and delivering what will become the anti-Indigenous racism framework. We are going to work with our non-Indigenous partners, allies, at the provincial, territorial, federal levels. Having said that, and before I go any further, I just want to take a little bit of a sidestep, Marion, as crows like to do. I'd like to take a little sidestep and recognize that this year is the 20th anniversary of the Nursing Excellence Awards, something that has been delivered by the former Health Canada, but always through the First Nations and Inuit Health Branch. I'd like to recognize that Indigenous Services Canada is again the lead in helping us look at the Nursing Excellence Awards for First Nations, Inuit, and Métis nurses across the country. The deadline will be this Friday, March the 4th. So please take a look at the ISC website or the CINA website and fill in your nomination form. Bring forward one of those frontline nurses that you're aware of in your community. Going back to some of the points that Dr. Cleary had made in regards to the statistics in regards to vaccine, vaccine efficacy is there as long as the community is on board. As long as the community has been provided with the information to participate and engage knowingly in the vaccine, to be prepared for what some of the effects of the vaccine will present. These vaccines are new to our people. And the strengths and weaknesses that have come out, the data has now just been starting to be tracked. The data and the information that is collected by the federal provincial health authorities, is that being shared with our Indigenous health organizations? How has that data governance agreements been developed? How is the data going to help with our analysis to the gaps, to policy, to health legislation, to health services. We want to be able to share with you the information that you're collecting about us. We want to be able to utilize it when we're looking at our colleges, our regulatory, our faculties that are teaching medicine or teaching healthcare to our people, both Indigenous and non-Indigenous. We want to be able to look at the data that you are presenting in these forms. The data that's being delivered, of course, is necessary for us as the Indigenous Nurses Association to be able to play a bigger part in how we're going to address health human resources. And how does that happen? Unique identifiers. People are afraid to put forward, I am First Nations, I am Inuit, I am Métis, because of the racism that is unfortunately alive and well in the workplace. It is for those reasons that we're trying to look at unique identifiers. We're working with our partners to determine how that will help us as we're establishing retention and recruitment. We can't recruit if we can't keep what we already have. What we want to be able to look at here is some of the research too that is going to help us when we're looking at some of the diseases, the chronic diseases and pandemics like this one. We hope that there will never be another pandemic like this. But if we have to, we want to be prepared. We want to have all of our frontline workers. We don't want to break our nurses like we broke them this time. The very spirit of our people is in the heart of our healthcare providers. They are the very focal point of our communities. They are the lifeline to the community, to the outside world, to the specialty network groups. What we're looking at then is how racism harms health. And we know that happens when you walk into a place like the Thunder Bay Hospital, where you're coming in with a symptom and it's been pre-diagnosed because of stigma, because of some racial profiling, and because of who you are. I know, we've all been there. But I think that what we need to look at here is how racism is going to be aligned within the healthcare system. Is it something that we're going to, do we have to set up another set of determinants of health? How are those going to play a part in how we look at healthcare? How are we going to help our non-Indigenous allies meet the calls to action? So far, they've only done 9. As Marion knows, and I do this quite often, I look at the TRC as a launching board, the calls to action. Numbers 18 to 24 are the health, congruent to the 7 teachings. But there are others that play a part in how we're going to help them in the path that they develop with us, not for us. And with those things in mind, we want to be able to exercise some of the TRC's calls to action as part of research, justice, social conditioning. We want to be able to look at the cases like Brian Sinclair, Joyce Echequan, and the many other untold stories that have not come to light. We hope that they won't. Healthcare is not where these situations need to be brought forward. Healthcare is about caring for people. We want to be able to look at the fact that there is a significant amount of missing research in our systems, that we want to be able to address the research that is missing, and we want to be able to do this with Indigenous research ethics in place. Thank you so much, Marion, for this opportunity today. Thank you, Rose. Thank you, Elish, for being with me today and making me part of this conversation with you.
Thank you so much, Marilyn, for bringing forward. I forgot 2020 was the year of the nurse, and it just baffles my mind that this is where we are today. so far away from where we were in 2020. But I do want to say we're going to take a quick break and be right back.
For others. There's a harsh world out there telling us who to be, what to be, telling us that we don't deserve love and respect unless we're something we're not. After I got assaulted, after I went through the trauma, I went back home and I connected with my roots and I connected with my family. Their wisdom helped me a lot. My family, my kinship, they rejuvenate my soul. They remind me that I deserve love. Our culture teaches us something powerful: compassion.
Welcome back from our break, and it is time for the question and answer segment of the program. But first, I want to do a couple of shout outs to our viewers and our listeners. I do want to say a special hello to Jonah and Dawson, Sherry and Amanda. Thanks for checking here for your credible, accurate, and reliable information. And Travis, Sheila Ann, and Noel, thank you for watching as well. Dr. Cleary, come on back into the crow's nest. Here's a question for you. With reference to what you had mentioned earlier, with some of those provincial restrictions starting to ease a bit, we know that the Federation of Sovereign Indigenous Nations, so FSIN in Saskatchewan, actually said, okay, the province is going to reduce the restrictions, but we're actually recommending that our nations keep them intact. What are your thoughts about nations putting in place some of those protective measures that we've been observing for the last couple of years? What are your thoughts about that? Should communities who are still seeing those high rates keep the masking and all of the preventative measures in place? What are your thoughts, Dr. Cleary?
Yes, I think it's really important for communities to look at what's happening around them and determine for themselves what is the best and the most appropriate action that they can take to protect themselves and the community members. Because it's very, like at a provincial level or federal level, it's very hard to determine what one particular community needs, and there has been quite a variety in terms of incidents of cases and outbreaks across the country in terms of community. So I think the best and the most accurate risk assessment is really at the community level. And if that means putting in place measures for a longer time while the transition happens, then I think that that's really important, that that's what happens.
Thank you for that. I really appreciate it. So I'm just going to ask you to mute. And Marilyn, come on back into the crow's nest. Marilyn, we're both members of the working group that supports the action on the national dialogues in racism. I have to say, I really appreciate what nurses bring to that table in terms of voice, in terms of advocating for curriculum changes. What are some of the takeaways, Marilyn, from those dialogues that are really sticking with you? Is there anything that was a light bulb moment or anything that came out of the recommendations that you're really holding on to? What are your thoughts on some of the discussions that were happening within those circles?
Thanks a lot, Marion. The item, the fact that I think that unfortunately we have to deal with the issue of racism. And like Rose had also mentioned, we have to develop a pathway for our young people and how to deal with, where do you pick up your guide on how to deal with racial profiling? How do you how do you do that assessment before you get to the hospital so that you're not going to be determined as a low priority, as a color code? And I mean that in another pun, not the hospital coloring code. But one of the things that I think is important is the fact that we as Indigenous people, we have nothing to reconcile. So those calls to action don't mean anything to us, but they mean something in the ability for us to develop and to nourish the relationship that we have with our non-Indigenous allies, agencies, organizations, and partners at various tables, to sitting with them to saying, how would you like to do this now? What path would you like to go down? The Indigenous healthcare providers have met the standards that have been established by the Western world, by the Western alignments, by the Western protocols and accreditations, and we have an enhanced ability because we also have Indigenous experience, Indigenous knowledge, Indigenous translation, the language. The language of our land, regardless of where we come from, is the voice of our strength. And that is what we will utilize when we go forward to address healthcare administration, practice, practicum, lessons, so on and so forth. But I think it becomes where we're looking at the education mechanisms, like both Rose and Dr. Cleary have mentioned. What is being done in the colleges, in the faculties? How is the content being introduced? Who is applying the standards? Indigenous people are now at that table. And coincidentally, CINA for the first time is also now part of the National Advisory Committee on Immunization. So we sit at that table and we participate in the recommendations on health measures with our partners from the Indigenous Physicians Association of Canada. And together we collaborate on the recommendations and how they should move forward, because it is a scientific and technical committee. Above and beyond that, I also tend to draw those back and say, but what is the regulatory and legislative impact of those recommendations on our people? Thanks again, Marion.
Well, don't go away, Marilyn. I've got another question for you to comment on. I know that we have been hearing quite a bit within the national dialogues that we have to have a safe space to report racism. What are your thoughts on creating those spaces? Have you heard of any mechanisms that are being created to report racism in the Thunder Bay Hospital or any other? I feel like we're picking on Thunder Bay, and I gotta say, I love me the pink icing sugar on those cinnamon thank you. Oh, so I digressed. I must be hungry. Marilyn.
So
reporting racism.
So one of the things that we want to be able to do here is, how do you do that? How do you identify a safe space? Who's safe space? Who's putting forward those indicators? What measurements have we identified as a safe space? And who has been engaged in that discussion? We know that Dr. Lafontaine and with the participation and collaboration of the National Association of Friendship Centers, had developed Safe Space. an app, and which is being applied in BC. And so what we're going to be interested in doing is seeing how that can roll out across the country, meeting the needs of the regional jurisdictions, the issues that are being dealt with there. So that way we don't have to deal with, we want to make sure that it respects the protocols of Indigenous leadership. We want to make sure that it meets the standards of our non-Indigenous partners. We don't want to step on anybody's toes, but we don't want to reinvent the wheel. When we look at this, we're also looking forward to what FSIN is doing in regards to their ombudsman. They're the first province going out with it. I suspect that there will be other programs that will be done in a similar fashion throughout the other regions. And that will be interesting because, again, the CINA, the Indigenous nurses, will have an opportunity to participate in some of the dialogue and the development of that framework and what it will do and where are we going to house the information that we collect, because it has to protect our people and their knowledge. Thank you.
Thank you, Marilyn. I love always sitting at tables with you and being the other half of M&Ms. Rose, come back into the crow's nest. Get in on this dialogue. As Marilyn mentioned, FSIN moving forward with an ombudsman person. I probably enunciated that wrong, I appreciate, but I just do it to keep people on their toes and laughing, that's all. Such heavy topics, right? Rose, what are your thoughts on provinces moving forward with this type of structure? You're a former federal government worker as well, so you have the systems concepts down. What would you like to share with our viewers and listeners on your perspectives of provincial ombuds people?
I think it's a great idea to have, now I don't, the word is ombuds people, let's use that word, to have somebody or an organization or an agency or office which is tasked with and funded well and has the influence to respond to complaints. But I think it also might go along with legislating the UN Declaration on the Rights of Indigenous Peoples. We need to see the laws and policies and systems shift along with responding to complaints, because some of these systems are actually enabling inequities in the system. So if we have a lot of complaints, and we do need to hear them all, so I'm very glad that people are starting to build up the systems that are safe, that people can share their experiences. But we also need to talk about system shifting. And there is a lot of research out there around how ombuds can be effective in their roles, but it is around the systems that support them. And so those that do start into those roles of being an ombuds person, I hope that they would have the full support of communities and colleges and faculties, because I can't imagine that would be an easy role to play. However, I think we do need them in the country at this point.
Thank you, Rose. Dr. Cleary, come on back in. Ailish, what is the federal government? So I'm just going to read the question for you so I don't get it wrong. And thank you, everyone, for sending in these questions. It's so important for us to have this two-way dialogue. So Dr. Cleary, is there a plan to provide federal funding to support local, provincial, and territorial work addressing Indigenous specific racism in healthcare? I think we know the answer to that is yes.
Well, the answer is, I think, yes. And I would just like to say how important it is that happen, because I've been listening to Marilyn and Rose, and I've been really impressed, that's not the right word, but encouraged by hearing you say what you have been saying. Because I'm a doctor, I care about people's health, And really, those are the things that make us healthy. If we're not, if we don't feel empowered, if we feel afraid, if we feel embarrassed or somehow diminished, if we can't even go to a hospital or a healthcare center without feeling comfortable to do so, we're not going to be healthy. And so I definitely think that this is a very, very important thing. It's a very important question that was asked. And certainly I think the answer is absolutely yes.
Thank you so much, Dr. Cleary. Rose, come on back in. And I just want to draw on your role now in doing cultural humility training. So tell me, Rose, for our non-Indigenous viewers and listeners, why? I mean, I get the obvious. Joyce Echaquan died, Brian Sinclair died. We know that racism impacts our life expectancy, but explain to some folks who want to be allies what it looks like to present at a hospital. Why are we afraid? What are some of the things you hear or explain to the people in your courses about those fears?
You know, it's hard to describe the fear as an individual who looks, obviously I look First Nations. It's hard to describe it because it almost is so part of who I am. And that's so sad thing to say. So here's what I've said in some of the courses that I deliver. I deliver Indigenous cultural competence humility courses. We used to do it in person. Now they're all online. Thankfully, a lot of organizations and healthcare organizations are now starting to develop their knowledge on really basic things, the terminology, when to use the correct terminology, what offensive slurs actually are, knowledge about the history of Canada, especially for healthcare, the knowledge of the origins of what we called healthcare back in the early 1940s and how the inequities in healthcare funding was literally built in from the very beginning. But you know what? Let me tell you this one little story I told one course, a group in Toronto actually, and I'm fine now. Let me just start by saying that. I slept in Toronto and I broke my arm. I ended up in Michael Garron Hospital, it's a downtown hospital, and I was taken into emergency, and the admitting clerk saw me and saw how much I was pain and served me immediately. That has never happened for me. I've broken other bones in my life as a youth. The admitting clerk saw me, immediately prioritized me into triage. The triage nurse saw me immediately, helped to get the appropriate drugs so that it wasn't so immediate, so incredibly painful. The intern came in and asked me, now get this is in Toronto, asked me, where are you from? And he knew what that question meant. He knew that I was First Nations. He also knew that I probably wasn't from Ontario. This particular intern was not Indigenous. He had done his knowledge, he had done his homework, his development of his knowledge and capacity to serve me as an individual, as a First Nations. Now, I have never been in a hospital in which I was served immediately, in which I was given the appropriate drugs immediately for pain, nor should given any respect for who I am as First Nations. That's how I tell the story, because for white Canadians who walk into hospitals, you have a privilege that you take all of this for granted, and I cannot. And for the one time that I experienced it, now I want it every time.
I really appreciate you sharing that personal story with our viewers and listeners, Rose. Thank you so much. Now we're coming into, I got to tell you, this hour, it flies by so fast, but I do want to give a couple of opportunities for final comments. So Marilyn, in like a minute or less, what do you want to leave with our viewers and listeners who are watching today?
A couple of things. A couple of the things that are important to looking at our Indigenous healthcare providers. First of all, remember that it's the 20th year of the Nursing Excellence Awards. go to the ISK website or the CINA website, download the application, nominate a healthcare provider from your community. Secondly, racism will not change overnight. It has been around far too long and rooted in far too many of our systems. Is the system ready to address it? As we've seen, unfortunately, no. However, we have allies at our table like Marion, like Rose, like many other Indigenous healthcare organizations to stand up and say, here's what we think you need to consider. Here is what we recommend based on our experience. Listen to our voice. Thanks, Marion, for a great afternoon. Rose, Dr. Cleary, thank you for your time.
Well, on that note, I do want to share with everybody that you need to stay tuned to the First Nations Health Managers Association because we have exciting news coming down the pipe on this very important topic. We ask that you rise against racism with us, and we have a whole campaign planned for you in the upcoming year. So stay tuned where we unpack and bring public service announcements about Rise Against Racism. It went by just like that. And hello, Lenore, Kaiser, Carolyn, Linda, and Bev. We want to remind you that it's never too late to get a question in. We will take the question and send it to our appropriate guest or bring it back on a future town hall show. And those questions again can go to fnhma@ihtoday.ca. And don't forget, you can watch this on APTN Saturdays at 5 p.m. So until next time, we wish you safety, love, light, and happiness. Stay safe, stay strong, stay resilient. We'll see you next week, same time, same channel. And until then, hi.